We have a very unique situation in this institution in that we are both a freestanding, independent tertiary children's hospital, but also closely aligned with a very robust, dynamic biomedical research university. And that affords us both the benefits of being independent, but also the benefits that come from that academic affiliation. One thing that makes our program unique is that our core pediatric anesthesia fellowship is fairly small, typically 2 trainees a year. What that translates to is that our cardiac trainee essentially can do the entire surgical case volume of our institution. That's a notable difference in our program compared to others that have a lot more trainees.
Every single cardiac kid that came in, every single case, everything interesting, whether it was in the cardiac OR, if it happened to be in the cath lab, or if it happened to be even a cardiac kid having a general case or like a tracheoesophageal fistula, I was the one who got to do those cases. First and foremost, you have to love kids, and you just have to have that interest in learning that anatomy and that physiology and that drive to take care of really difficult cases. And I would do it because you feel so good once you do it, and just knowing that you can do hard things, you can do complicated things, you can take care of these sick kids.
Every day we had the opportunity to manage complex and dynamic physiology in fragile babies. It takes a lifetime to master this specialty, and there's a unique type of person, a unique type of physician that's drawn to that. If you enjoy a fast-paced, challenging environment, a close multidisciplinary team, and complex physiology, this is the field for you.
Every child is different. Every lesion that they're born with is different. And the anatomy and physiology and just working through what you expect to see from them and how to fix it, it's very complex and just, it's fascinating.
We expose our trainee to rotations in echocardiography, clinical perfusion, and the cardiac intensive care unit. In addition to those required rotations, we afford electives in electrophysiology, adult congenital heart disease, and neonatal ICU for trainees that have those interests. We believe in graduated responsibility in our program. So early in the year, our fellows are heavily supervised one-on-one with a cardiac faculty. And as the year progresses and they've attained some foundational skill sets, we begin loosening the leash a little bit, with the goal being that by the end of the year, they're able to function independently with even the most complex cases.
They were great at teaching, but also great at standing back and just letting me do my job and giving me tips and advice along the way.
We're entrusted with the care of the most vulnerable children in the hospital, and we owe it to them and to their parents to treat that with an enormous amount of respect. This is a very dynamic, fast-paced, challenging environment that we work in, and it's also richly rewarding.
My favorite part about Omaha is just all the good restaurants. There's so many fantastic restaurants to go and try, and there's a group of my coworkers and I, and every month or so we try to get together and go try a new restaurant, and it's a great night.
Our expectation is that when a fellow graduates from our program, they can work in any children's hospital in the country and perform cardiac anesthesia at a very high level, whether that be in a smaller private practice environment or in a rigorous academic environment. We want our trainees prepared for both those options. We want to create future leaders in the field.
Taking care of them just brings you so much joy, just seeing them and taking care of them. There's one kid, I'll never forget him. He came in really sick. It was such a hard case, and now we see him come back for follow-up procedures in the cath lab, and he's doing wonderful. And it's so good to see him doing so well.